My name's Peter McCorrison. I'm the Director of Substance Abuse Services at AMHC, which is located in Aroostook County. We're a nonprofit mental health substance abuse provider. We provide services throughout Aroostook County. We have 5 outpatient offices, and we provide a continuum of services from ambulatory detox to outpatient, IOP, residential crisis services, and also some prevention services as well. The first challenge that we took on was access to services, and we did that in our Caribou outpatient, and we moved towards an access group, and we went from somewhere around a 35-day wait down to 4 days. Throughout our whole organization, we've implemented other process changes based on team thinking and team engagement to decrease our waiting. So now we're around 3.5 days throughout our organization. The staff that are engaged in the process, and we've really spread this throughout our whole organization at this point, really seem excited about their job. I think sometimes there's a real parallel process in the work we do, and I think staff can feel at a loss, that they can't impact client no-show cancellation. They can't impact access to services. And I think staff are really seeing that through simple process change. They can. They have some level of control over some things that are going on in their environment with their customers, and they can positively impact their show rates and their ability to produce their units of service and see change. I think NIATx has helped AMHC do more with less in a couple ways, because I think it's one, being part of the group and sharing information and getting ideas from other organizations throughout the country has been really helpful and exciting for us. But I think also we've been able to do more with less, because as we continue to try to implement changes, some of them work, some of them don't. When I look at what we've done with our intensive outpatient program, we're providing more service with less staff time, less staff travel, and also, given our rural nature, there's been a number of times over the last few months where we would have had to cancel the group because we wouldn't have had enough customers in one location. But because we're accessing 2 locations, we're able to continue to do the group, which is good for the customers, and it's also good for our bottom line. We had a pretty wild winter in Aroostook County. We had almost just short of 200 inches of snow. And when we implemented the IOP using the matrix model, we were running that out of Madawaska. We basically had people traveling throughout the St. John River Valley, anywhere from 60 to 70 miles. And as we got into the fall, we saw that the no-show cancellation rate was really just going through the roof. The customers were saying that they really enjoyed the group, they found it beneficial, but they just weren't able to drive, and also with the price of fuel being as high it is. So we implemented using televideo, compressed video, where we have two locations, Fort Kent and Madawaska. We have staff co-located at both sites, and so that allows the customers to access service. And we've gone from a no-show cancellation rate in November of 50% down to 8% in May. It went up a little bit in April to 16%, but even at 16, that's lower than our norm for no-show cancellation within our substance abuse program. So it's really been, and the staff really like it, and I think it's really helping us move towards looking at using other technology and providing services within our community. AMHC has become a lot more flexible in our willingness to try things as a whole agency, and we would not have done that without our engagement with the NIATx effort. So we see now taking risks that pay off. And in the commitment of a month, we generally do cycles of 4 weeks because it's just easier to collect data that way. That commitment of the month is not too daunting to implement something, and if it doesn't work, you do something differently.